See what's happening in China, what's happening in Europe. So there is a third wave coming. This is the right time to get vaccinated.
We can't be stupid to learn from our mistakes.
Dr. Dhar, there are people who are saying that, we all know that the number of cases are falling, and some level of herd immunity, people are saying, has been achieved in India. So, because the cases are falling, the fatalities have always been lower. So, they say that we do not have an incentive to take the vaccine. They're saying, हम mask लगाएंगे और हाथ sanitize करेंगे, तो vaccine लेने की जरूरत क्या है? So, what is the message to such naysayers?
I think we can just see what's happening in China, what's happening in Europe. So there is a third wave coming, and it's very, you see, nearly 30,000 cases per day. I think we should not wait for such time to happen in India also. So it's better to get vaccinated at this point of time. They should not think about the number of cases going down. It can come up anytime. Then we don't have the requisite infrastructure for the same thing. I think this is the right time to get vaccinated and don't wait for the third wave to come. Regarding masks and these precautions, you have to still take that. If you get vaccinated, still you have to continue with those what you are doing before.
Right. So that's well taken, Dr. Chatterjee and Dr. Peters. Would you like to add to that?
So my take on that is two things. Number one, the cervical cancer vaccine may not give 100% protection. Would you give it to your mother, your daughter, your wife? Yes, you would. So why not this? Number one. Number two, we can't be stupid to learn from our mistakes. Science and statistics is basically to learn from other people's mistakes. Europe and a few countries did not really look or take care of the vaccine, and they said it's open. They discarded the mask and everything, and they had the third wave. Why should we put a risk of our lives when we can do a simple thing like taking a jab? Even if it is, I'm saying, even if it is effective 10%, I would still take it, right? So let's not wait for the third wave. Number one, it puts a lot of stress on the economy of the country, on the government of the country, on the medical personnel. Please look at the doctors who've lost their life fighting for COVID, right? Right. So I don't think so. It's really worth it and even worth discussing that we should not take this jab. Even if it gives a protection of 70, 80, 90%, we should take it. Number one. Number two, we should not put stress on the infrastructure of our country. It's a huge country with a lot of population. And I believe that we should just go ahead with whatever is available to us right now.
Fair enough. Dr. Chatterjee, we should take the vaccine no matter what. You agree with that?
Absolutely. There's no doubt about this statement. See, what happened to Europe? What happened to US? They have the best healthcare systems. Italy has the best healthcare system. They were thinking that they would have a herd immunity with this virus, and they really faltered. The number of cases went up. If UK and if US can falter, and the number of cases going up and the number of deaths, even one soldier dying in those countries is really, they consider it to be very precious. See the number of deaths that they have had because they thought that they would produce a herd immunity and they didn't take the essential precautions. So we as a country who lack that level of health infrastructure, I would strongly recommend that we should take the vaccines so that at least we are protected. See the other countries which have the capability to fight such a disease at this level have been totally overburdened, and we cannot afford to do that. So it's a strong recommendation that we should all get vaccinated as soon as possible whenever the government allows it.